plant hanging there.
Who would have thought watering a houseplant would result in a fractured spine? Certainly not Dorothy Eastwood.
All I did was reach up. I was going to take it down to water it. And I felt something in my back, something grabbed the base of my spine.
The resulting pain was constant and unbearable.
Lying down, sitting up, walking, it was just there all the time. And it drove me pretty much to tears. And believe me, I'm not one that just lies down and cry very often.
For years, the go-to options for spinal fractures were pain medications or an open surgery. But now doctors have a procedure that fits in between the two. Dr. Paul Fuchs is Dorothy's doctor.
The previous treatments weren't ideal, and now that kyphoplasty has been developed, it's one way that we can stabilize the fracture, which is what we want to do, and it's more of an internal stabilization of the fracture.
Here's how it works. Once the spot is identified on live x-ray, surgeons make an incision about the size of a fingernail and insert a hollow needle, creating a pathway to the fracture. An orthopedic balloon is inside the needle. When it's inflated, it compresses the break.
You can see the balloon now blown up, and that's again compacting the bone.
The balloon comes out, then a semi-liquid cement goes in through the same needle and fills the void.
It takes 4 or 5 minutes for that cement to harden, and once it hardens, the fracture essentially is healed.
Kyphoplasty is performed under general anesthesia or conscious sedation.
The pain relief is significant, and the patients traditionally can go home that day.
With her fractured spine fixed, Dorothy is getting back to her daily duties.
I was always a very active person. I was working until this happened, so I wasn't really ready to just sit around.
For Lee Memorial Health System, I'm Amy Oshier.